attendance today.
That's right. It's 12:02.
There's lots of, well, there's not a lot of people. I know.
Expecting a few more people to this.
I suspect our Friday time in the summer is going to be light, a little lighter on attendance.
Got me a mallet so we can start somewhere near on time. Thanks to Amber.
Yeah, let him borrow my mallet.
So, welcome everybody. Not a lot of us here today, as you can probably tell. I thought there'd be more board members. I could understand a lot of county people extending their holiday over the weekend. But we'll get started with introductions. A couple people on the Zoom that I don't recognize, so we'll start with Zoom. With Jessica, the first one I see.
Hello, everybody. I'm Jessica, community board member, co-chair. Can you hear me okay?
Yes.
Good.
Stephanie.
Hi, everybody. Stephanie Utzman, board member. And I also, really quick, I'm going to have to pop off at around 12:45 to get to another meeting at 1. I apologize. I've double booked myself.
I can't read the names. Is that Jill?
Hi, Jill. Yeah.
Hi, I'm Jill Kaufman. I'm a crisis supervisor, currently the interim program manager for the crisis program. So that's why I'm here. And I might have to pop off a little early as well.
Okay, good to have you. I can recognize you, but I couldn't. Wasn't sure about this distance and how far away you are.
First,
Linda.
I'm Linda Nolte. I'm a guest today, and I'm an adult foster home provider for IDD.
Okay, thanks for being here. IDD, there's Paul.
Hello, everybody. Paul Partridge, program manager for the Deschutes IDD program. Sorry I couldn't be there in person today. Working on some walkthroughs of a couple of new homes up here, one in Redmond and one in Madras. So couldn't quite make it down there for the meeting.
Hey, Kristen.
Hi, I'm Kristen Mazaki, Program Manager for Deschutes County. I oversee the adult outpatient programs and our 2 clubs.
See, Cameron just joined us too.
I'm Emily Bergsmith, Executive Assistant, but I'm just covering for Dana. I think Cameron did maybe come off mute there for a moment. If you want to introduce yourself.
Yes, hi. Sorry I'm late to join. Cameron Fisher, OSU Cascades, teach Human Development and Family Sciences. I also have 2 teenagers.
Amber Clegg, Clinical Program Manager for Behavioral Health. I'm covering for Holly Harris, our Behavioral Health Director today.
I'm Melinda Thomas, board member.
Commissioner Patty Adair, board member.
And I'm Roger Olson. I'm the chair of this committee. And as far as announcements, do you have things from Holly?
I do have a few things. Whether I can speak to them other than sharing the updates, that may be another story. So be kind with me with any questions. She wanted to share that the Secure Residential Treatment Facility RFP should be coming out in July, and this is the this is the plan for adding 16 secure residential treatment facility beds here in Deschutes County. So adding 16 beds, secure residential treatment facility beds. So the RFP for it is coming out in July. So
That's adult only beds, right?
that's adult only. Yeah. But that's good news, and I know it will take some time, obviously, to get all that up and running. Child and family, we're always going through, speaking of building, we're always going through lots of building changes. You know, we just continue to grow, and each time we do grow, we think about adjacencies for teams and where they're located. So one of the other changes we're looking at, we're in the process of looking at remodeling Courtney Clinic, this building here. And part of that is to bring Mosaic Medical, who's on the first floor here, up to the second floor so that we are integrated more fully with them. So our psychiatrists can work right alongside their medical provider, and our nurses can work alongside their nurses, case managers, behavioral health consultants. So just even being separated by one floor has provided some barriers in care coordination. So we're really excited about that project. It's going to be probably 1.5 years, I'm guessing, before completion, but we're really getting into the thick of the weeds of it right now, and it's really exciting. But with that, our child and family program that has been here at this location for a long time, the plan is for them to move out to our Wall Street Services building, which is downtown, and it's across the street from the main county admin building. And they'll be joining the rest of the child and family comprehensive care team. That includes our team that serves ESA clients, RAP clients, and young adults in transition. So they're going to move down there to be a part of that larger team. And that will improve care coordination for those teams because they sometimes share clients. And again, just not being in the same physical space can create some challenges in communication. So that is our plan over the next year and a half for that. Buildings are a constant moving target with remodeling and moving and all the things.
Growth.
Absolutely. Yep. Let's see here. Holly wanted to share that Representative Jason Kropp and Senator Ron Lieber, what is his first name? They're coming out in July to tour the Stabilization Center and Taylor Center. Does anyone, what's the Taylor Center? Jill, do you know?
Best Care.
Oh, Best Care.
Sorry, I was muted. I can tell you, or if someone in the room knows, that's fine too.
Yes.
It's, it is part of Best Care, and its intention is to be a place where people can get
Having a hard time hearing you, Jill. You have to come closer.
Is this any better?
Yes.
Okay, it is ran by Best Care. It's a place where folks can drop in 7 days a week and get SUD support, like get items they might need, like bottled water or sunblock, or get to detox. We send people there sometimes from the Stabilization Center. We run a couple of groups out of there during the week, but it's really it's a really nice space. It is kind of trying to think. I'm not always the best with directions, but it is like where Marshall and 3rd Street, kind of in that neighborhood. If you're ever down that way, it's a cool space to check out.
Thank you, Jill. So it sounds like they'll come tour both the Stabilization and then that Taylor Center. And she said also to learn more about the newer iteration of Measure 110, the deflection programs here and the mobile crisis team programs. I see that Cameron has her hand up.
Cameron,
Yeah.
got a hand up?
Yeah, I do. And this may not be the right time to ask, but just hearing about the 16 adult beds coming, which is fantastic. Any update that you can provide on the potential residential for children and youth? I know that's been kind of discussed for the last several years, and I thought we were getting somewhere, but any update on that?
I don't have a current update from Holly on that, Cameron. Sorry, or for the rest of you. But we can put that on the list for Holly to.
Okay, I'll save it. Yeah, thank you.
Yeah. Yep, I'm aware that's been a long time project. You know, hopefully someday we'll actually see something in our area.
Yeah, having worked at Trillium, Trillium Residential we had many years ago, and just seeing how long the stretch has been without that. And then I always, I think just having teenagers and all of us who are around teenagers, we just see the mental health challenges that our teens and kids are facing, and just how desperate we are for that east of the, particularly Central Oregon, east of Central Oregon too, of course.
Yeah, in fact, my access team is right in the midst of a really challenging case where the child has been in the ER for, I think, close to a week, and trying to find placement out of the area. So it's just.
Yeah, that's exact. And the only thing is farm home, right? That's the closest, right?
So we'll try to get more of an update on that from Holly when she's back.
Thank you.
Yeah. And then the last thing I just had was the OERs. They are attempting to create more flexibility in the timeline of requirements that we have regarding our documentation. And they've released some emergency rules. They are kind of continuing to change them right now. So we're in this weird place of trying to figure out, how to comply with the rules. And they also are looking for feedback right now on these rules. And so I am actively immersed in all things OERs right now and trying to submit feedback to them. And the plan is for them to file permanent, I use quotes for that because nothing's ever permanent, but they hope to file permanent rules by the end of October. And we really do hope and are seeing some flexibility coming from OHA that we haven't seen in a while. So I really hope that results in just having an easier way to get clients into services with less cumbersome paperwork requirements.
Kind of where we were 10 years ago with that.
Coming right back to that intake packet, Roger.
Yeah.
We may get to a place of reducing it by a page or two with this process. So we shall see.
So Karen.
Yeah, please do. So those are the updates I have at this point in time from Holly.
Well, I can add one that Nicole Van Leeuwen's been selected to program manager for the crisis.
Correct, yeah.
Crisis team to me. I don't know if that's what the official title is.
Yeah, that happened after Holly sent me these updates. Jill, do you want to chime in?
We're really excited for it and for her. She'll be in place on August 1st.
Yeah, and Nicole's been with the crisis team for quite a few years now. She started out mobile crisis team and has done work with civil commitment at the hospital, has been a supervisor with our forensic diversion team, and just has worn a lot of hats and has been really immersed in forensic and crisis work for quite a few years now. So we're excited to have her as the crisis manager.
Besides working with CIT and stuff with Nicole, I work with her privately, in my own family situation, and I've always found it to be really, really professional, really, really good to work with. Glad to have her on board doing that. And as far as introductions, I also had letters from, or emails anyway, from Lorelei and from Christina, so they're excused for today's meeting. So put that out there. Another piece of announcement, I guess, came to me from NAMI, Oregon, that there's going to be a webinar with a number of people from Oregon Health Authority. NAMI's involved, of course, and CCO for most of the Portland area. What do they call themselves? Care Oregon. Anyway, talking about how we might, going to be a series of webinars, I guess, to see if we can fix the state's access problem. Okay, form is part of their Oregon Health Crossroads series, the upcoming virtual panel titled, "Can the State's Medicaid Program Help Fix Our Behavioral Health System?" I think we all know that access in Oregon is about the lowest in the country, and so this is an effort to those issues, and there'll be an interactive audience Q&A. On the Oregon Health Authority website, you do have to register, and there is a ticket charge of $15 to register for the whole series, I believe. It's next Wednesday, June 26th.
I did bring something that was relevant.
Yeah.
We actually signed, approved a grant updated with the state. It's for $3.9 million. It was dated, believe it or not, December 31st, 2045. 2045. Okay, I'm like, really? And this is grant funding from OHA for behavioral health housing. So that one of those was for building 2 adult foster homes and supporting the intellectually disabled. And then I do have notes here about youth on it. And they have 131,000 was for the lofts for beds, and then remaining 718,000 will be for supporting youth shelter. But you know what? We've been pushing on doing something for youth, that 16-bed limit forever. So yes, as you say, Amber, it's gone on forever. Anyway, I did bring that document today. How relevant was that? But can you believe it when it says 2045?
Did you get the money?
No, actually, no, it's through that date. I'm like, really? The terms need to be that long? It was dated 42 and I thought, well, that's a mistake. It should be 24, right? No, it's supposed to be 45. So that's my life in a nutshell. It's like, okay, what do you think? Will we get this done? We will get it done.
We'll get it done.
Yeah, we have to. It's just unbelievable. We've signed letters for a couple years on it. It's unbelievable that it's not there yet.
Thank you for persevering.
I never give up. It just seems like it takes forever.
Yeah. I spend most of my hobbies driving back and forth from Portland to Corvallis to all the various places with my stepson. Just never anything close to home. That'd be better.
And Rimrock in Prineville, is that facility at all functioning? It was like at 15, 16 bed facility. Is it? And then I heard it was like down to 8 because they didn't have the staffing for teenagers. Do you know, Amber?
A year and a half ago, where they did have to limit their operations for their substance use disorder residential program out in Prineville area. But they're back to open, I believe it's full capacity, but somebody else can correct me if I'm wrong.
It is full now.
I think it's back to full capacity, but it's primarily substance use disorder treatment for adolescents, and is not a facility in which we could place youth that is in need of significant behavioral health intervention. So it's limited in what the type of services they provide, but it is at full capacity that I'm aware of. It was limited for a little while.
Right. They didn't have staffing.
And they also had one for that decade. Until it was right before that and COVID. And they take people from around the state as well, because there are only a handful at that level of care you've been set states. So they're still fighting up with that with the systems. But they are better and more open than they were in 2020.
Good to hear.
It feels to me like this conversation.
I'd just like to draw us back to the agenda. We're in announcements. I hate to be so direct, but
Jessica,
we have.
this is
Can you hear me?
important.
I know it's important, and maybe we need to bring it on the agenda item, but we're past a few things. We have a presentation today that's waited a couple of months. I'm sorry I'm not there in person to bring us back into the agenda, and I apologize for interrupting, but maybe we should discuss if we want to continue to talk about this or move forward in the agenda. I guess that's what I'm saying.
Okay, so we have to approve the minutes, huh?
Yep, we gotta approve the minutes. We have a board or a quorum of members to approve the minutes.
It looks like we do with the people on the screen.
I can't remember.
Roger, you are supposed to know this. You are our chair.
I will move to approve the minutes as written.
Second.
Okay, it's been moved and seconded. Now we have to All those in favor?
No, you have to ask any further discussion,
Any further discussion?
and now you can ask for that.
Okay. All those in favor?
Aye.
Thank you.
Perfect.
Done.
Maybe you can put on the July agenda a discussion about youth resources.
Right, we need to talk about our kids. I don't know if you all saw, but they just lost two 14-year-olds and sisters. And I actually am connected to that and to one of the other kids. And it's
Yeah,
unbelievable.
they've had a bad string in sisters the
Yeah.
last couple of years.
Yeah, I'm just,
Okay, the other announcement that's on the agenda is our two committees that when we rewrote the bylaws last year, we included to have two committees, at least two subcommittees, need 3 members each, an onboarding committee, which is there's 2 words involved with it. Membership and onboarding committee. We have 1 volunteer for that so far. We need 2 more. And we have a community outreach committee. We were talking about doing things in the community, getting out, be visible. We have 1 volunteer for that. We need 2 more. So we'll be working on that. Let Dana, Jessica, or myself know, and we can get those committees up and running and doing business of the board.
Roger, I think there was a request of Holly to see if we could have a Deschutes County behavioral health representative on the onboarding subcommittee. Is that right?
Yeah, that was a question that I had.
Yeah, it sounded like she was supportive of that, and she wants to ask our manager at our manager meetings. That might be a topic on Monday to have Holly. She wanted to check in with clinical managers.
Cameron, your hand up again.
Yes, I heard somebody mentioning about putting something on the agenda. I was wondering if I could propose something else for another meeting agenda, whether it's next month or the following. Is this the time and place to mention that?
Go ahead.
I saw for Ben Lapine, somebody in Nutrition Services, Gara, I can't remember her last name, was awarded something for public health for the Public Health Advisory Board for Deschutes County. And I was curious about if we consider doing something like that for somebody in behavioral health in the field at large of the community, of doing some sort of annual award for that we all nominate or contribute in thoughts to recognize folks who are doing amazing work in the community in behavioral health. I'm just that maybe bringing that to an agenda sometime in the future would be really interesting to hear people's thoughts.
That's a good topic for later. Can you send me an email detailing that a little bit, so we will get into one of the board business kind of things we need to do?
Yeah, will do.
Thank you. Okay. Jessica.
Yes, do we have enough people here to vote if I make a motion today?
We already voted on a motion, so hopefully we do.
Yeah. Okay, then I'd like to make a motion that this meeting be amended from 1 hour 15 minutes to 1 hour and 30 minutes.
Any discussion?
I would personally support that only because when we have speakers come in
we
from.
need to have a second to the motion, and then we can have, did somebody second it?
No,
I'll second the motion.
Okay.
And I'd support that only because it seems like when we bring in community speakers, it's hard to give them enough time, but also to have time for us to do some board business, which I think that I'd like to see us get a little bit more active in some of the work of our board.
And I support it too. We went to 1 hour and 15 when we were on Zoom, exclusively on Zoom, because wasn't in much chance, or people weren't as verbose, I guess, talking back and forth and making comments. And so we lost a lot of that, and we were always running short. But now we're here in person, we have a lot more business, I think, to take care of. We have a really strong full board. So I support going back to an hour and a half. So, been moved and seconded. How about all those in favor?
Aye.
Okay, looks like it's a unanimous vote from the quorum that's here.
Thank you.
Thank you, Jessica. Okay, youth board member presentation. Melinda, you got the rest of the time.
All right, I don't think I'm gonna take the rest of the time, but
Well, we cut you short the last two
no,
times.
that's okay, and I sped read last time. Can you, Emily, get that up on the screen? And so Emily is going to put up kind of my outline that is very similar to the outline that was up at the last meeting, but we've since had one subsequent meeting. And so we have some revisions to this that I thought I would go over. But again, to recap the committee work that we've done, it's Julie McFarlane and Jessica Vieira and myself so far. And we'd love to have other people join us on the committee if this is something you're interested in. Other work that we've done besides we've had what, 2-3 meetings so far? I've had a conversation with the previous, one of the issues is how to refer to this position, but I'm gonna say intern board member, just as a place marker. That was with Kate West, and Kate was a high school student, but as I think I mentioned last time, she was going at the time to the Redmond Proficiency Academy, which I'm not sure if all of you are familiar with, but their model is much more independent and flexible, so they don't have a lot of classes back to back like most traditional high schools do, and that gave her the flexibility to be able to set her own schedule and attend the meetings whenever I don't know if they were on Fridays, and it was also during COVID, so there were remote meetings as well, and so access wasn't as big of an issue for her. We're not sure that that's going to be the case for moving forward for most youth who we might be considering to join this board. And Julie McFarlane had a conversation with, I can't remember her name, April from OSU Cascades, got a very enthusiastic reception about the idea of having some kind of an internship or position for a student. I don't know that we would be asking enough of the student to have the student be awarded credit, but there could be like a stipend. We'll talk about that in a little bit. So that's some of the work that we've been doing. And so the last meeting, I'm going to go through some recommendations and issues that we need to have some decisions on. We thought, and we feel fairly strongly about this, that we ought to start with one student. Since this is kind of re-upping a new program or feature of what we're doing, we want to start slow and see how it goes, and then it can evolve to more people as we scale up or grow, or we get some clarification on what the role is. So that is one recommendation that we have. One of the questions that we have, the next two bullet points, is what does the board want to do in terms of who do we open this up to? Our mission or our function, if you look at the little flyer that's in our onboarding thing, says listen to and learn from people with lived experience. So that's right in our mission, and so that seems pretty important. But we also talked about looking for a student, and it could be both. One person could have both lived experience and also have connection to our local colleges or even high schoolers. But we kind of feel like going with the college age group or 18 to 21 is probably our priority, just to make sure that they have access. They don't have to miss school on Fridays. They've got transportation and all of that. But we do want to talk to you about what your vision is for who do we open this up to. We started with the college idea only because it's sort of a built-in marketing recruitment avenue and path. We could talk, somebody's in college, you could put up flyers, you can talk to counselors, you can talk to April, who Julie's already talked to. Or do we want to open it up? Would we want to consider somebody with lived experience who's maybe not a student? And some of the pros and cons of that, a student that has lived experience. some of the pros of that is, like I said, it fits with our mission here, and that's what we want to hear from people with that lived experience. On the other hand, there may be some difficulties trying to recruit. They're not necessarily tapped into a larger community like a student would be who has an interest in this type of work. It's not a total barrier, it's just a consideration. And we want to make sure that we don't have any obstacles for their attendance and if there's transportation issues or, anything like that. And so it's just some sensitivities that we need to consider if we open it up to that. And so Kate West, our prior student, had suggested that we look for somebody with some local ties who might stick around for a while and have some knowledge of the Tri-County area and Deschutes County in particular. If we're looking for a student, do we look for somebody with specific majors or interest in behavioral health or public health of some sort? If we look for a student, then do we want to try and find somebody that can really be proactive, reaching out to other students in their college environment? And so those are some discussions. I'd like to open up a discussion and get your thoughts about what you think about who should we be targeting. Any thoughts? Cameron?
Yeah, I think this is great, and I love the idea of going into the higher ed realm. And the department I teach for, Human Development Family Sciences, most of our students in that department, if not, we have a few different strands under that, but one of the most popular is social services. And most of my students who go on to be counselors and social workers and mentors in different ways have lived experience. And so I think that would be a great avenue of one, you get kind of folks who are tied to with their major, their interests, but also lived experience. And also it's one of those majors where we have a lot of folks who are from Central Oregon for that major with already some work experience under their belt in the field. And so I would love to bring that back to my students or department come September. And then the Zoom option, I think, is that this is continued is a really fantastic option too. So just throwing that out there.
Jessica?
Yeah, I just wanted to point out, and part of the subcommittee when we met, we had a good discussion about, what type of individual that we would want. And we did talk about the students, kind of having some sort of a safety net versus somebody who maybe has a less safety net. And so I think that's where the discussion came in with maybe one or two interns or students. But we're now looking at one. I just wanted to give that kind of background that we weren't ignoring folks that maybe have less of a safety net, but we want to make this a good experience. And so that's kind of how that landed. I just wanted to share that.
Sorry, our apologies. We are having some background or fuzziness.
For some reason, we're not getting real clear audio from you guys.
I think it's our speakers in here, so I'm sorry to everyone on video. Hopefully you can hear us okay. And we're working. We heard what you said, and it's just coming with some static, unfortunately.
Here's the well anyway.
I don't know if we'll be able to fix it while we're in this meeting today.
But
I like the idea. A college student is restarting this or creating a more evolved form of this. It's safe to start with a college student, right? Not only are they with pathways in their programs, but also trying to get a degree. There's intangibles that are. And I think it'd be a good starting point. And then hopefully through our outreach and other things, maybe build off of this to then experience those peer support specialists type things, recovery mentor folks come into the field and find things from different areas. But this makes sense. I like the college idea. it's a COCC too, but they have a lot of Wednesday, Friday classes like this hour.
Oh, they do?
So
Okay.
at least they do more there. It's on my hours, but yeah, OSU is pretty flexible. I basically have a graduate program Cameron taught me, but they have a lot of focus in my area. They would be knowledgeable of some of the things we'd be asking of them. It would be a good applicant pool. And in terms of just it's a good idea. I think that it's a start.
And one thing that we could do too is, we'll talk about an application for this a little bit further down on the outline, but we could we could prioritize lived experience. And, like Cameron said, most of the students that are there probably are there because they have some sort of lived experience. And we could also, to sort of what Jessica was saying, if we got a college student who has some safety nets, I mean, if they're in college, she's right. They have some safety nets that other youth may not have in the community if they have behavioral health challenges, personally or in their family. But we could ask that student, associate member, whatever we're going to call them, to help us advise on that and kind of take a look at and examine that issue. But I do like the idea of starting out with an applicant pool that, it's an easy draw from for our first year. And then hopefully this will grow into something a little bit more comprehensive and fulsome. Any other thoughts about this? I mean, I think the idea is that we'll open it up to anybody. It's just, I don't know that we want to limit it only to somebody with lived experience that's not a college student or a college student that doesn't have lived experience. We open it up to everybody. We just need to figure out how to recruit. If it's somebody that's not a college student, and I'm not clear on that, like where would we go to search out people that might be interested?
I'm not either, because that's kind of what we've been trying to do since Kate left.
Yeah.
Well, is trying to figure out where we can get somebody of that caliber to come and help us. So.
Yeah, I think I just recommend you start somewhere, right?
Yeah.
And see how that goes. You'll learn a lot probably this year with the recruitment process through the colleges and whoever applies or gets selected. And I would like down the road for there to be consideration of how do we open it up to other people so we aren't just focused on college students or a broader perspective potentially, or a different perspective anyway, right? But I think you got to start somewhere and go for it.
I don't know as we hit these decision points if we have to vote on them or if I just get consensus from the group and we run with it. Roger?
I don't know. I don't either.
I don't think we did that much discussing when we got Kate. So
Yeah,
I mean,
we're fine, go floating
yeah,
along.
just
Yeah.
keep going.
Okay.
Because I think it's really critical to have somebody younger on this group.
Okay.
We're not up against a deadline or anything.
Yeah.
We can, if we need to vote, we can vote next month or something like that.
Okay.
Take those things back. And, my input, I guess, would be a lot of those things that might be criteria that if we're doing this in conjunction with either COCC or OSU, that they could make some of those choices and we don't have to really all the requirements that we're looking for with just general requirements. And then when they're looking at their pool of students, they can kind of make some of that determination.
Or at least recommendations for students that would, okay.
Not sure how that works.
So then moving on, our thought for a term would be to start fall of 2024, just kind of roughly track an academic year. Whether that extends into the following summer or not is probably just a function of what that student or that person is able to do. It seems it's my first summer meeting here. I don't know if there's typically a lower attendance in the summer. I imagine like most boards there is. And so that might be
Kind of looks like it, doesn't it?
Yeah. So anyway, that's our thought. That's our goal, is to try and get somebody on board for the fall. And for like a 1-year term or 9 months, somewhere, whatever works. The other recommendation is that from the committee is that we assign one or more of our board members to serve as a mentor, kind of a point of contact for this youth member. And that would look like having a monthly check-in with the student or youth. And that could be a rotating mentorship. It was interesting because we had our last meeting at Julie McFarlane's house, and her son has lived experience. He would actually be the ideal youth for this. He has lived experience, and he's also a psychology major at OSU Cascade, so he kind of checks all the boxes. And he asked if he could sit in on our meeting just to hear kind of how we were discussing things. And then afterwards, he said that, or he chimed in that as a youth, he would rather have one constant point of contact through the year. And, these two youth still getting to, their sea legs under them in the world of, professionals and meetings and networking and all that. But so then we talked about maybe we have one person that's kind of in charge, but then a monthly rotating, like a lunch maybe with Captain Schultz or, Roger, and so that the youth gets to know us throughout the course of the year. So it's a real personal thing, and they develop a network among us. And so I don't know any other duties, if there are any other duties for our board. This is for us. What are we offering as mentorship? Do you guys have any thoughts about that? Oh, and I skipped a thing too. I'll go back to it. Jessica? You're on mute.
Can you hear me okay?
Yeah, there's static, but we can hear you.
Okay, hang on a second.
It's not you, I don't think.
I don't think it's you. It's our issue.
Okay, so, okay, I was going to lower my hand. So a couple of things that I was you can hear me? Okay, sorry. I was thinking that a mentor might include taking the student to some of our providers so that they get a breadth or a knowledge of our providers from different perspectives, whether it's mental health, substance abuse, homeless services, IDD, and then also perhaps going with them to go to the jail with Captain Schultz. So there would be some behaviors attached to that monthly meeting with the student to kind of open them up and provide them with some education around some of the services, and perhaps be able to, in coordination with Holly, et cetera, go see or maybe be in a meeting that's more macro in level around the services offered in Deschutes County, that kind of stuff, so that, they understand the system.
Does everybody agree with, do we have a consensus as to whether or not we should have one mentor sort of in charge of kind of coordinating the rest of the, visits to the providers and resources, and then, networking among the board? Is that a consensus?
I think having one mentor to make those connections, whether, they went to every connection or not, is not that important right now. But just so somebody would make a connection with the board, and if this person besides your school wouldn't have to be trying to talk to different people every time.
Does that sound good to everybody? All right, so I think we have a consensus on that. And I skipped over the title for this person. I wanted to acknowledge that when we started having this conversation, we had been referring to this youth member as a board member. Some of the issues that are coming up with that is that we serve 3-year terms on the board, and we're talking about a youth member who's going to serve less than that. And so I personally don't think that this is a position that is a full-on board member that has voting, can vote. It's really just somebody for us to hear from and from them to learn from us and the community. And so I personally don't love calling this person a youth board member because it just misses some of the criteria that the rest of us, that apply to the rest of us. I personally like something like associate member. We talked about intern. To me, intern connotes some credit. or pay or some benefit that I don't think we're prepared to offer, at least this first year. And so I'd like to have you all give us your input about what do you think the appropriate title for this person is? Any thoughts?
Well, I like associate member. I wonder if there's a student number, name for somebody that's not an intern, that is a, I don't know. If, they would have some other input onto what we would call. I think just an associate member.
Might want to stay away from student if we're opening this up to
Right, everybody. That's
people
right.
that are not just students. Any
I'm
other
not
thoughts?
sure. This is Linda. I'm not sure how to raise my hand, and I'm only a guest, but I do have an impression of the word intern in other professions implies practical hands-on experience, and I would echo what Jessica had to say about getting a point of view that's more than an administrative overview, more that's more full than just administration or leadership or policy making, that have it really teach and expect some understanding of the reality of every day, not just the leadership part.
I understand that's leaning in favor of not intern. Okay.
Yeah.
So I'd just like to, when I was at the subcommittee, I shared with Melinda and Julie that in California, and I don't know about here, but we have TAY, which is transitional age youth. That's what, and there's a lot of TAY here, TAY there. I don't know if we use that here. And that's typically between 18 and 25. That's where our funding in Sacramento kind of focuses. But if we had like a TAY member, it would be a transitional age youth member. I don't know how people feel about that. And while I'm here, we might have to loop back around it. I kind of am in favor of them having voting, and that's a different subject, and we can bring it up later. But getting back to the name, I'd just like to throw that name out, TAY, Transitional Age Youth Member.
I'm going to add my 2 cents worth on acronyms in this realm. I came into, as you all know, or you may know, I work for the High Desert ESD, and when I started, my supervisor said, "You're going to do special education." And I said, "Okay." And then I was promptly handed like a 3-page document with all the acronyms that are associated with special education. And I imagine in behavioral health, just being part of the meetings here, I'm pretty sure that there's a lot of acronyms that you guys are all working with as well. And I find them difficult to navigate. And so I hesitate to do another acronym that we all are going to have to remember, but that's just my point of view. I'm also my memory is a little poor. And so I think it's my own issue trying to familiarize myself and remember all the acronyms.
Well, you're right, Melinda. How about just a traditional transitional age youth member? Well, amend that, but that's just a suggestion.
Any other thoughts?
I agree that internship, if there's not mutual deliverables and our expectations of them, it's something they provide to us. Then maybe you two, I think that makes more sense. But associate member, representative, kind of language, whether it's student representative, community representative, something that's respects what they're doing, and they have status, but it separates from just showing up. It's something in that realm that makes more sense for it. And something, if year one, we keep it student focused.
Any other thoughts? Cameron?
Yeah, I want to echo, I think it was Melinda about acronyms. I think it's so challenging when you're in lots of different circles to keep track of all the acronyms. But I also think some of the words in that acronym that was mentioned might be helpful, or also just kind of what Lee was saying, something that is kind of, if it is becomes designated as a student, I think, or keeping it a little more general as associate, either one of those. I think student advisory member. Also, I see this in, like, for the city and school board and other realms, they use student voice, something like that. And I don't know if that makes sense for this, but I think that the idea of intern can be a little misleading because I don't know if there's actually an internship at play here. And maybe I missed something. I don't know. But those are my 2 cents.
Well, okay, so I hear that we've got some consensus that we need something like representative or, youth, the name youth, some words that we can combine for that. Before we move on, maybe it would make sense to talk about Jessica's thoughts about whether this person is a voting member of our organization or not, because if that's the case, then they truly would be a board member as opposed to something else. So Jessica, do you want to speak to that a little bit more?
Okay, yeah, and I'll just, the reason, yes, I will. And the reason I raised my hand is because, a youth might not like to be referred to as a youth. So just kind of keep that in mind. They may see themselves more mature or an adult. So as we are identifying the title, we could keep that in mind. The reason I would like them to be a voting member is because if they have a voice, I'd like them to be able to exercise their voice when there are motions to be voted on. And that's in a nutshell. That's really all I have to say about that. That's why I want them to have voting opportunities.
One question that I have then is if they're voting, then they're a member of BHAP, I think. But
Okay.
our membership is 3 years, and if this person serves a shorter period, would we need to amend the bylaws to accommodate this?
This is Cameron. I agree about the comment about youth. Not all younger adults want to be use that term youth. But I also feel that it doesn't seem appropriate for them to be voting members because it's going to be lucky if they are able to come to 9 meetings or 7 or something like that. So to ask them to contribute more than as a 3-year term, or even just, I think we can still get their voice and perspective in maybe a set time on the agenda every month.
But we're not giving them the full scope of voting. I just think that's like, come to our house, but come through the back door.
One thing we could do is if we have a motion, you have the motion and the second and then discussion, and they can add their discussion during that part. I just don't know if we want to go to the effort of amending our bylaws to create a new member of this organization that's only for 1 year, because I do think we'd have to amend it if we're gonna have them be a voting member of BHAB. And I don't know what's, amended bylaws.
And I've also seen this done in lots of different realms where there's still a very important consideration to student voice. They are not necessarily members of the board, but there is a clear, appropriate time for them to share their perspective and advise. And so I don't know how you might be able to do both, or we could say it's an option to join the board for 3 years. But most students will not be able to commit to that.
Any other thoughts?
I think you would probably have to amend the bylaws if you're going to do something different in regards to the length of time of service and vote in voting. So that would be, I think you're right on. You have to really consider bylaws.
And it might be something that this evolves too. Again, this is our first year kind of jumping into this. And so maybe we, put our feet in the water and call it something else. I hear you about, they don't like to be referred to as youth. but I also feel like that's exactly what we're looking for. So I don't know how to bridge that gap. Because we're making it specific to youth or young adults maybe is a better, I don't know what their preferred term is.
Emergent adult is kind of the popular term now.
What?
Emergent adult is one of the common terms now, post-adolescence, but prior to like full adulthood, kind of that, 20 to 24 range or 18 to 24 range. But yeah, I don't know. Maybe that's a brainstorming session for a couple of folks to come up with something alternative, because I think Jessica does have a point about the youth piece.
I'd like to get the name figured out today if possible, only because we keep talking about this with different names, and next steps would be to start implementing an app, the recruitment process. And so, not to beat a dead horse here, but I would like to get this figured out. Jessica?
Okay, so I'd like to recommend that we call it a transitional age youth member, because it says everything there, or a transitional age member. And we could either, say yay or nay to that and then move on.
You want member or representative? You had said something about representative.
I mean, in terms of
whatever is feels comfortable. I feel like I'm mostly focusing on transitional age. The rest I don't much have a feeling about.
Is there consensus
Nope.
about using transitional age, and then we'll either say member or representative at the end?
Yeah.
Yeah. Okay.
Are you guys all good with that? Okay, member or representative?
Probably representative based on, we're going to let this unfold in terms of who and voting and all of that stuff. So maybe representative. Is that what you like, Melinda?
It's not my decision. I just want a decision from the group so I can move forward.
Let's go with representative. My voice.
And then those of us that like acronyms can say TAR, TAR, or something like that. Okay. All right, moving on. So the expectations of the student. So our expectation would be that they attend BHAP meetings and to come prepared to provide some youth input. We discussed at our meeting that it might be helpful for us to, and we don't have to do this today, but come up with a list of prompts like what do we want to hear from this transitional age TAR? It's called TAR. What do we want to hear? What kind of input do we want? And so do we have some questions or prompts that we will provide to them that they know that they're going to come to the meeting and speak to that? Not a long presentation, not the whole half hour that we've been hearing from other community partners and agencies, but just maybe 5 minutes just to say, hey, what's going on right now? What have you seen? And here are some prompts. And if they know what they have to answer, and they've got some flexibility. It's not going to be, but just give them an idea of what we'd like to hear from them. So we talked about that. We also talked a lot about, we are an advisory board for the Deschutes County Commission. And as far as I know, we don't go to the commission meetings, but that might be something we want to talk about our board membership. Maybe that's something that we should be thinking about doing, like rotating and having somebody. That led into the discussion about whether it would be a good idea to ask our transitional age representative to attend a couple of commission meetings, just to also learn about, local government and how that functions. And then we also thought it would be important to have the transitional age representative attend maybe 2 events around, like maybe the NAMI walk, or there's other events that we'll have to kind of fine tune the calendar, which I think we have on the website, but we can, give them an option, but here's the expectation. So that's kind of our thoughts about expectations of the student. Do you guys have any other suggestions that you would like to have us consider and implement?
I think along with those expectations of the students is an expectation of us as the board to make this public service, whatever you call this, just volunteer services, aware, bring the awareness to the younger people coming up that this is really a valid thing. Get on some of these boards around town and have your voice heard. I just, for years, clear through my 40s, I guess. You know, I always thought that was just a bunch of old people making decisions about something or just sitting around talking about something. And I never really wanted to be on a board of any kind. And then when my son got ill and I didn't know anything about it, I just started coming to these meetings long before I was ever a member. I always sit by Lori Hill, I don't know if you remember Lori. She'd always tell me what the acronyms meant. Anyway, so I learned a lot about acronyms and stuff. So, you know, I think it's important for us as board members to include them in as many things as we can. Going to a county commission meeting, you know, a previous director saw the value in it. Of course, we had a different county commission at the time. Was a county commissioner that always asked, well, what's the public going to think? And so when Scott Johnson was the director, I was there often because of my job with the road department. So he'd often say, I'd stay there while he did his presentation, and if that commissioner asked that question, he'd say, well, it's somebody from our board, you know, and I could say, the board heard about this, and we're all in favor, or things like that.
So
Scott was
that's
really
just,
adept at using public sources, public people.
so an encouragement to become involved in other
Right.
community organizations,
Yeah.
maybe other boards.
And hopefully they'll go back, you know, with their associates that they meet with on a regular basis, whether it's around pool table or where it is, they can share some of that. Get, you know, more than one person in that age group on this board.
And we can also do that through our mentorship and our rotating, you know, if the mentor arranges with this transitional age representative to meet with, say, me for lunch, then I can explain the boards that I've been on or the community involvement that we've been. I think that we can inspire that way too, because that'll take some time, but I think that's a really good encouragement. Any other thoughts about what expectations we might ask of this transitional age representative? I need to see so much easier now that I have a name.
I like the expectation that we're giving an experience that's educational and they can carry with wherever they go, network, whether we're mentoring and showing them aspects of the field, they're going to county commission meetings, they're whatever they bring to our meetings, we're referring to that paper to voice what represents. Clearly give us input, advise us, which we advise them like that. I think that works. You know, a minimum amount of commitments. Fine tune that. I think that's a good start. Definitely a good start to this program.
Any other thoughts? Refinements, additions to their expectations we have of them? All right, I think we've got pretty good consensus on that. And so the last bullet item on this section is, do we want to consider a joint venture with NAMI? NAMI proposed this to Julie McFarlane, who she's on their board. And I think at our last committee meeting, we felt like Jessica raised a good point that, you know, once you start partnering and this becomes a joint venture, then it becomes, you know, we lose control over the process and we lose control over selection and what it looks like. And so at least for this next year, I agree with Jessica that I think that the partnership overly complicates what we're trying to do right now, but it's something that we could consider down the line. Jessica, do you have more to add on that?
No, I think that was good, but I will take this opportunity to, what I said, well, we had a good discussion about NAMI, and what was really favorable about that was that NAMI was going to come up with some reimbursement for the student, but then there was tied to expectations and yada, yada, yada. And then it became, well, then we really wouldn't have a youth, I can't even say the old tie on that. I'm not going to do an acronym, but a transitional aged member, they really would be a representative of NAMI. So we kind of nixed that. But I think when Janice was the director, she had said something about stipends. And I would like to advocate for if to kind of bring that back. And I can follow up with Dana if people say, yeah, Jessica, do that. Around talking with Holly about any stipends available for the person. Because I think my assumption of this person is they're not going to be flush, okay? So that would be the only thing that I would say. But at this point, yeah, we had a good discussion about the NAMI collaboration, and I think that we identified that it might be more complicated than we wanted to do, especially in year one.
We can definitely follow up with Holly when she's back about the question on the stipend. I just don't have any answer to that.
Right.
myself. I don't know what's the option.
We might need to close that loop sooner than later, because once we start putting this out there and recruiting, we're going to want to announce that there is a stipend if there is. I don't know that it needs to be much, but I think that enough to cover some gas money and I don't know what other expenses that might be associated with this. I think that might be nice. And so Jessica, do you want to take that and run with it and try and, I'd love to have some sense by the July meeting about whether we have a stipend or not, because I do kind of envision like July is when we're going to start implementing some of this, getting an application out there, go recruit.
Yeah, I can't really see who everybody is there. I actually thought that the woman in the mustard color shirt, I think she's representing Holly. Yes, you. And I thought she was Holly. So that's how much I can see. So are you the woman who said, and plus it's gone in and out, are you the woman who said you could take it back to Holly?
Yeah, Amber or myself, either one of us, we could make sure it gets to
Okay,
Holly.
and you can reference that Janice had said it, when she was here, which was a minute ago. And then also I can follow up with Dana independently, but I know Dana meets with Holly weekly. So we'll have a two-pronged approach with gently saying that is a little bit timely. I can throw out a number too. Shall I throw out a number?
Sure.
I'd like to see it around $500. Again, people aren't flush at that age. Now, we can always negotiate up or down. We'll see where we land.
All right, so I have that Jessica, Amber, and Kristen are going to kind of loop together and figure out if we have a pot of money from which we can get a proposed $500 stipend. Okay.
I was going to.
And that, sorry, I didn't mean to interrupt, but I can't. And we don't have to give it to that person all at once. We can meter it out. So if they don't, if they don't lean in, we don't lean in either.
Are you thinking 500 total or like 500 a month? Total.
Oh, I like your style. No, it would be 500 total.
Okay.
That's a lot of money for a younger person. And if you figure they're there for 9 months, what's 500 divided by 9? Okay, that would be.
Then we need to decide whether we do this up front. We give them a check for $500, which I don't favor.
No.
Or do we do it at the end of the term, give them, if they've satisfied their, expectations, or do we do monthly?
We do halfway through, and it would be about $50.
What I've seen on a regular basis in now 4 different arenas is $40 per meeting. And I strongly would be against doing anything like this unless some sort of stipend is provided, an Amazon card, Visa, that sort of thing. I think from an equity perspective, it just doesn't make sense to just ask somebody to do this without providing that. So I think it's pretty standard nowadays.
Okay, so we can ask for 50 and go down to 40. How's that for good negotiation?
I think it's the question, can we do it in dollars? They want to go there, we can start with 500. But that's going to matter because it also sets the stage for whether or not a community member may assistance that can come into this role after year 1 with those 2 pools really do it.
That's a really good point.
Then we can set the stage for the growth of the position Or I know, yes or no. The dollars don't matter if it's not. So we should just get the yes or no.
In some ways, it's nice to have it to someplace so they don't, well, the social worker in me says go out and do drugs, but it's also nice for a person to have a freedom. So maybe, but we do have to think about equity among our community members that they also have hardship situations.
Well, I wouldn't be opposed to including, do the stipend, and then if we do have a community member that needs assistance, maybe giving them a bus card or a gas card or whatever they need to assist with their transportation needs as well. I mean, but I think that part we can kind of deal on an individual basis when we figure out who we've got, and if they have a need, we can ask them that in the interview process. Like, are there any barriers to you attending? You know, satisfying these expectations, and if they identify that as a need, then we can maybe, you know, I mean, I'd be happy to donate to that, even if we don't have a fund, but I imagine somewhere we can come up with a little bit of money to provide the stipend. Okay, so to close the loop on that, then I'll just wait to hear from you guys maybe before the July meeting so that we can kind of have an answer and come up with an amount then. Sound good?
Before we close that though, when you go to Holly, you know, let her know that other kind of hardship thing came up, just so that she's not blindsided, and so that we thought about that, but that we're going to focus on the transitional age member first, if you would.
Stipend plus additional amounts as needed to overcome hardship barriers for attendance.
And one more thing I was going to add, actually, because I do feel pretty strongly about this, is that I think it should be a set amount, and I think it should be a standard across the board because it's part of recruiting. So people don't feel in a jam when somebody they're you know, considering, or they sign up for this or are selected for this, whatever it looks like, appointed to this. But then they're on the spot having to respond of, here's what I need it for, or here's, yes, I need this amount, but it's just an expectation, and it's a way that kind of like standardizes it across the board that whoever's interested in this knows that this will be offered. And so it's very clear in the consideration to get people to think about doing something like this rather than saying, what do you need?
And that is in, how about we limit that, whatever, money, stipend, whatever, to the transitional age membership position versus across the board for now, because then we are identifying that.
Oh yeah, that's what I was referring to this position, but I mean, just for recruitment purposes, it's not like you wait and hear what their concerns or struggles or barriers are. It's just to make sure that everybody has access to it who's considering the position.
Yeah, that goes with the.
So if I hear you correctly, Cameron, you're not in favor of an additional amount, that we just have a stipend amount that's designed the amount to cover whatever their personal barriers may be. Is that
for anybody? It doesn't.
Right. So we don't get into this questioning about, do you have any barriers, and have to have them.
Yeah, I think kind of like that's where the general $40, when I've seen this done, is $40, and people can use it for whatever they want. They may just be on Zoom, but it's just for their time, or they may want to take an Uber, or they may want to, you know, use it for something else because they're spending an hour and a half or 2 hours with transportation time.
All right,
so it's more this idea of like, you are valued, your time is valued, and what you're bringing to this meeting is valued. It's not about, oh, whose barrier is more challenging than somebody else's, right?
Okay.
But I just want to be clear. You're talking about the youth position, not every community member.
Correct. This position you're talking about, yeah. And because most of them, you know, many of them are working full-time jobs, but some aren't, and some aren't working at all. And so, yes, absolutely for this. Thank you.
Okay. So we're running out of time for the meeting, so I want to kind of rush through a little bit. I'm not going to go through the proposed timeline, but our idea, it's set up there, and we can email this outline to you if you're interested in it. But it would be nice to try and shoot for the fall of 2024. What we need, the committee needs, is I need to have some people volunteer. I can work on an application because it's a little different than our membership application. But we're gonna have an interview committee. So I don't know, we'd love to get some more people involved. If anybody's interested in that, I'll stop there. Is anybody that's in this meeting interested in helping with that? I don't know that we want more than 2-3 people on an interview committee because that could be pretty intimidating.
Right.
And I think our committee, we have a committee of 3 and we're happy to do it. But it'd be nice to get other people involved as well.
If you need an alternate out of those 3, please add me to that. But I think
Cameron, is that you speaking?
Yeah, I'm sorry. This is Cameron. I think that 3 is nice, but if you ended up needing an alternate, I'm happy to join in.
So typically the commissioner's there and maybe Holly's there and Roger's there. I can be there if needed, but that, Roger, isn't that kind of like typically the standard? So we got to consider that.
I don't need to be there. I mean, that, you know, we may have to need either Holly or Dana or somebody from the county to be there. Patty likes to do those interviews.
Yeah, I just don't want to do more than 3. I think for somebody of that age, that could be really, I mean, it's intimidating for me to go into an interview and have a group, you know? So I'd like to say 3, and I'd really like to, I don't know that, since this isn't necessarily a board member, I don't know that it needs to have board leadership, but it can. I just think this is a good opportunity to get other people involved. So Cameron, I've got you down, and we'll kind of, we probably won't be doing interviews until August, September, so we can talk about this more in July. We need volunteers for mentorship. Julie McFarlane has volunteered to be the constant, you know, the year-round mentor, unless we have other people that are interested in doing that. And that would be great if you do. Anybody interested?
I'll vote for Julie.
And we can finalize this in July, also in August. Some of these pieces, the pieces that we need to do now to get it off is to get the application and the, you know, the recruitment started. So
Put me on there. I'll let you know.
for the mentorship,
The mentorship
excellent.
side, what the details are. So,
That's all I have. Thank you guys for your input.
You always need.
I think so.
Okay.
Thank you so much for pulling all that together. It's fabulous. Thank you.
Good job.
Really good job and good work, Melinda. And I just want to say that, you know, working with these 2 ladies has been really rewarding. And I just want to plug subcommittee work because it gives an opportunity to get to know somebody, understand their perspective, broaden my perspective. So I'm going to put a plug out for that. You know, we were, Melinda and Julie were organized, and I just want to really do a plug for subcommittee work.
It's felt really good to dig into something like this. Thank you, everyone.
I guess we can adjourn. We didn't have much time for open forum, but we don't have a lot of people for open forum either. So.
Sorry I was late. I had a work thing. The Penn Treatment Center is now doing same-day admissions 4 days a week by appointment on Fridays. And we have a lease. We are opening a location in the fall in Redmond as the only OTP, OUD, not pain management provider for methadone and reduced boxing. So we do have that coming down the pipe. I have some flyers. I'll bring you next month as well. That's why I was thinking.
That's okay.
Great, no.
Thank you.
Thank you.
Yeah. And yeah, motion to close.
Thanks, everybody.
6 minutes.
Bye.